Hello everybody. Welcome to this session of recall questions from microbiology that has come in our Fmge Jan 2023. So a disclaimer before we actually begin this. So this is just, what we try to do over here is to compile the questions as much as relatable possible that they might have shown up in our exam. So in case if there is a change in the wordings or if the options are different, please excuse us and don't butcher us in the comments, okay? And please do help us to give us the correct options or what was the exact type of wording that has come in the examination, okay? Now in the coming up session, what else we are going to see is, I'm not claiming that whatever the questions I'm going to discuss are the true microbiology questions or anything, but I'm just going to discuss those things that we actually, discuss in our classroom. Okay, so without wasting any more time, let us begin. And I hope that the session that we had, the most important questions just before the exam, that has helped you in this exam that you have just taken. Okay, as many questions what I told that time has actually shown up in your examination. Okay, so let us begin. What I've done is I've just, divided the questions, something that came from immunology, virology, bacteriology. So this is going to be a more systematic approach of the recall questions. Okay, so from the immuno section, my friends, one of the first questions is this: which of the following antibodies or immunoglobulins are found in the highest concentration in the blood or serum? And I believe everybody did well on this question, straightforward MCQ. The correct answer to this is going to be Doxab, IgG. That's the correct answer. And just as a relation, if you see in our important MCQs, 25 important MCQs, you can see we have discussed about the antibodies. As a matter of fact, you can see this serum concentration point we had discussed in that. Okay. So I had requested you all to watch my other videos of 25 important MCQs where I told you important topics are discussed which may come in your exam. So as you see here, this was the answer. The cell that participates in inflammation and is known to be macrophage, what is the name of that in liver? They're simply asking you what are the macrophages called in the liver. I'm sure everybody answered this correctly as well. This is going to be Kupffer cells. See, technically all the options that you have here, they are just the names of macrophages. It's just that in the liver, they are specifically known as the Kupffer cells, right? So again, this is just excerpt from our workbook where we have this thing in the fill in the blanks also, like in the liver, they are called as the Kupffer cells. Rheumatoid arthritis happens due to. I believe that these were the options more or less that are closely what I have taken over here. Rheumatoid arthritis, as everybody knows, that this is a autoimmune disorder. Now, if you talk about the hypersensitivity, the answer has to be, it is a type 3 hypersensitivity, right? This autoimmune disorder, there are one or two things that we all should know. It first of all contains the antibodies, what we call as rheumatoid factor. Now, what is this rheumatoid factor? It is nothing but a IgM antibody which is directed against the Fc portion of IgG. And second type of antibodies that you can find in this are something what we call as ACPA. So what is this ACPA that we find here? Anti-citrullinated peptide antibodies. These are the other important antibodies that we find in the rheumatoid arthritis. Okay, so according to the options that are present here, I believe the apt answer for this has to be autoimmunity. Next, again, in our workbook, we have this mnemonic, as you know, the SHARP, and you can very clearly see that rheumatoid arthritis is mentioned in this. A patient develops runny nose, wheezing several times a year. These features are due to degranulation of which of the following? So you should first understand they're talking about wheezing and this kind of words which are straight away relating to some kind of allergy. All right. Now, allergies, as we know, is due to type 1 hypersensitivity, degranulation of these cells, what we call as the mast cells that are going to lead to this. And please do answer, what is the mast cell going to release that actually produces the symptoms in the end? It is histamine, right? So that's about it. Again, just a recap. If you can see here, I had even drawn this diagram, and we had learnt in classroom that whenever the allergens come inside our body, like for the second time onwards, we have the mast cells that degranulate, releasing the histamine, causing the symptoms. Let's look at this question now. A person who met with a RTA recently had undergone grafting using patient's own tissue as shown in the image. Identify the graft from the following list. So you should all understand, simply they have given one word where you don't even need to look at the image, to be honest, right? That word was patient's own tissue was taken. And as we all know, when the patient's own tissue is taken, what do we call it as is autograft. This is one person's own tissue taken from one part of the body, and it is, grafted in another part of the body. Allograft is basically between same species, meaning from one human to another human. Xenograft is between different species, and Isograft is between the monozygotic twins. And you can just have a look, just in the recent 25 important MCQs, we had discussed about this. And very specifically in the autograft, you can see the example skin graft we have discussed. So now we have our next question. A patient presented with complaints of muscle weakness, ptosis that tends to get worse at the end of the day. The symptoms seems to get relieved with administration of a drug called as neostigmine. What is this diagnosis? I know, if you look at this question, it doesn't sound like a micro question, but just in our last discussion, if you see, our question was pretty much on the same lines, where I had discussed about this, the ptosis, the patient feeling better with rest, etc. So all this thing was describing which thing? It was describing myasthenia gravis, right? So there we learned it's a type 2 hypersensitivity. So this question had shown up pretty much in the similar type. That's why I've just taken this question as a discussion for you. In fact, as you all know, there were two questions on myasthenia diagnosis. One, I believe, with the word neostigmine, and the one without neostigmine. So hope you guys have all answered this correctly. Now, just as one important thing, Lambert-Eaton and myasthenia are pretty much the same things, except for one important difference, that if you compare them, what happens by the time the night happens in Lambert-Eaton versus myasthenia gravis. In the night time, Lambert-Eaton people starts to improve. That means with activity that is happening throughout the day, these people are actually getting better. So activity makes the Lambert-Eaton people feel better. Exactly opposite, what is going to happen in the myasthenia patients is, myasthenia people, they feel worse with activity. That's why when the day is over, right, due to the entire activity they might have done in that day, what is going to happen is they start to feel worse. So that's the main thing that you need to remember as a difference between myasthenia and Lambert-Eaton. Now we have questions coming up from virology. Pretty much a straightforward MCQ, my friends. Zinc smear is used in the diagnosis of. Now here's where I have a little doubt whether they have asked zinc smear is used in the following except, or did they ask zinc smear is simply used for one of the options. Okay, no matter what it is, the answer is simple. It is used for herpes simplex viruses, right? Which numbers? 1, 2 and 3. Although the third one is called as HHV, that is varicella zoster virus, right? What exactly is a zinc smear? Basically, it is showing you those multinucleated giant cells. So if the question was except, probably they gave you HSV1, HSV2, HHV3 and some other option. If that's not how the question was, options were like this, still you could easily answer it is HSV. So you can see here in our notes also we have very clearly mentioned HSV123 zinc cell, the multinucleated giant cell you had to memorize here. Very easy question to be identified even if you just look at the image itself. You know, as soon as they show somebody with a middle-aged person having a lesion in the trunk which involves the dermatomes, this lesion has to be shingles. And shingles is caused by the virus, as we know, known as varicella zoster. Molluscum contagiosum would have produced, the rash with a central depression. Measles is a completely different rash we can easily identify. Okay, so this has to be something that is shingles only. Okay, so our next question. Inclusion body of a virus is shown in the image. It is indicative of which of the following infections? See, the correct answer to this is CMV, cytomegalovirus. This question is more or less redundant. We all know the importance of this. We have discussed this so many times that this owl's eye appearance of the inclusion bodies is seen with cytomegalovirus. And I believe there was another question which was pretty much similar appearance called as the RS cell, Reed-Sternberg cell. That was also given in your exam. So two questions pretty much on the similar looking things. So if that was the same image that came, then this is it. Or if it was a different one also, you would recognize it's a owl's eye inclusion. Okay, so next question, my friends. A patient presents with GI distress. On inquiry, the patient informed that he usually eats food outside. Which of the following hepatitis can develop in this person? See, cannot be more simpler than this. They're just asking you which of the hepatitis viruses can spread through fecal-oral route. And only hepatitis A and hepatitis E can spread that way. So obviously our answer is going to be hepatitis A. So next question, guys, here we are. A child presented with maculopapular rash that began behind the ears, then it started to spread on the face and to the rest of the body. History reveals fever, conjunctivitis, runny nose that developed few days back. Most likely diagnosis is. See, if you see the history properly, right, if this was the things that they had mentioned, so you should clearly understand in measles, what happens is measles comes after 4 days of having fever. The rash in the measles is preceded by Koplik spots, right? And apart from the Koplik spots, you also get fever and the 3 C's of measles. Remember these 3 C's of measles? Cough, coryza and conjunctivitis. Coryza is nothing but the rhinitis or the runny nose. So they're mentioning you all those hints. So I believe you should easily pick up that this has to be measles. Once again, from our 25 important questions discussion, you can see this question which is in a clinical vignette format that we had discussed earlier, where I had given you all these things like conjunctivitis, right, the coryzal symptoms, etc. And the question was again on the measles only. So next question, guys, here we are. HIV positive patient with CD4 count that is less than 100 develops a pulmonary infection. A sample collected from the patient demonstrate acid-fast organisms. Which is the most likely agent? Let's first look at the keywords. HIV positive, meaning something special you should always expect. CD4 count is less than 100, less than 100. You know that at different CD4 counts, we can expect different types of infections. So since they're mentioning something very less over here, and that to a pulmonary infection, I know even if you didn't know anything, you would have chosen somewhere between nocardia and MAC. See, whenever we were discussing about HIV in our classes, I had very clearly told you that when the CD4 count becomes very less, let's say somewhere around 50, etc., you get MAC infections and CMV retinitis, etc. So you should all know this thing, guys. This has to be the answer, right? Because the CD4 count is mentioned. All right, friends. So now let's start discussing about mycology questions. Which of the following dimorphic fungus can cause subcutaneous infection? See, we all know this mnemonic body heat changes shape pretty perfectly. That mnemonic tells you all the dimorphic fungi. We had learned that out of all the dimorphic fungi, one of them is special because it has ability to cause the subcutaneous infection. See, what is this Sporotrichosis going to cause? We learned this, right? Important questions again, same thing. If you just remember, Sporotrichosis is a rose gardener's disease, meaning you get it through thorn prick, right? When the thorn pricks you, obviously it goes below the skin, hence it's called as a subcutaneous infection. All right, so here we go with our next question. A forest worker recently had a trauma following which he presented with a verrucous growth on the feet. Which of the following is the most likely infection? All right, so what is the keyword that you all need to notice over here? Verrucous. Verrucous or cauliflower-like growths you should remember two guys. One is human papillomavirus, HPV, and the second one is this fungal infection called as Chromoblastomycosis. So Chromoblastomycosis, those words like specific buzzwords, what you see, verrucous or cauliflower-like lesions, and I told you this is important for questions, that is sclerotic bodies, etc., and they have come up in our exam. Okay, so here's our next question. I'm not sure if this was really asked, but some students have told me, sir, the Cryptococcus indiae stain was asked. So if this was asked, then I believe that this was an easy question for all of you. As you know, so many times we have paid emphasis on this thing. India ink stain is a stain used for staining the capsule. Especially for this fungus, we have talked about Cryptococcus neoformans, the one that causes meningitis in AIDS patients. Now, this is a brownie point question. That means just one extra thing. We have said that majority of the fungal infections that are serious in nature would be treated by one drug called as amphotericin B. So as you know, cryptococcal meningitis is a serious infection. So the medicine that we will have to use here for its treatment would be liposomal amphotericin B. In our classes, we had also learned mucormycosis is also a very serious infection. That means even in that, the drug of choice was same thing, that is amphotericin B. Next, which of the following is least important factor related to the development of mucormycosis? See, this has always been a hot topic since this outbreak has happened in India. So I told you mucorpe question more or less is expected. Have a look at this. Mucormycosis, one of the most important risk factors is diabetes mellitus, especially diabetic ketoacidotic patients. So this is an important risk factor. Steroids, we have said, are very important in causing mucormycosis because steroids will suppress your immunity. Next, neutropenia, the word itself is telling you that your WBCs, the cells called as neutrophils, would be less. And then you have chronic use of antibiotics. Okay. Now, this place you have to apply your mind a little bit and you can easily rule out this thing. See, even if you know DKA and steroids are the important things, neutropenia makes sense that obviously this may lead to infection. Chronic use of antibiotics can be the least important factor from this list, right? So this has to be the correct answer for this. So this is just the emphasis that we had paid here. I told you DM, that is diabetes mellitus, is an important factor, especially the DKA. You can see the steroids also, steroids, iron chelators, etc. These are all important risk factors for mucormycosis. Next, we have our parasito questions, doctors. A female presented with foul-smelling vaginal discharge. Wet mount was prepared and the microscopy of the discharge reveals motile trophozoites. What is the most likely infection? Okay, obviously, since the word trophozoites is mentioned, we know trophozoite is a stage of protozoans or the parasites. And who's a parasite being mentioned over here? It is nothing but your trichomonas. And this exact question we had just discussed during our 25 important MCQs. All right, now our next question, please do help me out with it. I'm sure the question language wasn't as simple as I've mentioned over here. If you guys recall this question, please do help me out with this. What most of the friends of mine told me that is, sir, there was a question on our mnemonic that we learn in class called as sand. Because below our feet, sand is present. That's how we had memorized it. So the organism would be Strongyloides. Strongyloides, Ancylostoma and Necator, they penetrate through our feet. On contrary to the other options called as Enterobius, Ascaris and Trichuris, what you're seeing here, they are the ones that enter our body through ingestion of eggs. That means they cannot be the answer. If really that was the question that came, then again I would say that we were lucky that we had just discussed these points also over here. I've told you about the ascaris, the egg, etc. Even the clinical presentation, where during the discussion of this question, I had told you about, the ways the parasites can enter your body. All right, so we have our next question here. That is, an unconscious patient is found to have fever, sweating, and severe paleness. What is the most likely diagnosis in the presentation? See, one or two things we can straight away rule out here. Fever is present, but nowhere they have mentioned the neck rigidity. If it's not neck rigidity mentioned in the question, then the meningitis, encephalitis, these can be more or less ruled out. So, ab bacha cerebral malaria. Now, what hint was there in the question to hint you that this might be malaria? As you know, malaria parasite comes into our RBCs, right? And this RBCs may get stuck in places causing different types of issues. See, when the parasites are inside our RBCs, they keep rupturing them, leading to anemia. And when you get anemic, what do you find, Doctor? Paleness. Paleness was the catchword here to actually hint you towards the cerebral malaria. Now we'll be starting with the bacteriology questions. An adult male who is a truck driver having multiple sexual partners presented with an ulcer on genitalia. What is the investigation to be performed? Okay. Now they're mentioning clear-cut ulcer. I had told you when you're studying the STDs, you should know to divide them into discharge and ulcer-producing STDs. So since ulcer is mentioned, now you should be thinking only in those STDs that can produce ulcer. I don't know if painless word was mentioned or not. Some people said it was mentioned, some said it wasn't. So anyway, if painless ulcer was mentioned, then you know it is syphilis straight away. Okay. Now from this test anyway, let's try to rule out the things. P24 antigen test, yes, it's done for HIV, but again, HIV is not going to present with ulcers like this, right? VIF test is a test done for Gardnerella for bacterial vaginosis, so this cannot be the answer. Gram stain cannot just directly tell you which is the STD, etc., right? So the best answer for this has to be dark field microscopy because of the ulcer, since we were thinking syphilis in this person. There was a whole discussion on the STDs I have done. I had told you STDs would be asked. Anyway, the exact wordings, if you see here, Treponema pallidum, we talked about it, where I told you we have to do dark field microscopy, as you cannot do the gram staining for this guy. So again, this time we were very lucky, I would say that. Okay, another question on syphilis. A truck driver with past history of genital ulcers presented with the following lesions. What is the most likely diagnosis? Now, you know, just from the previous question also, the lesion that you see in the primary stage of syphilis is called as the chancre, whereas in the secondary syphilis, the genital lesions we see condyloma lata. Apart from this, I had told you in secondary syphilis, a very important feature would be rash, right? These people start to develop a rash that particularly involves the palms and soles. Okay, so the answer to this will come down to secondary stage of syphilis. Some people may have tilted towards the hand-foot-mouth disease. Why that wouldn't be the answer here? The reason, doctor, look at the age also. Hand-foot-mouth disease more or less is found in children. So this is one thing, and genital lesions were given. Now what else do we need as a history, right? So that's why syphilis has to be the most appropriate answer over here. You can all just have a look, right? Very specifically we have this in our workbook that yes, the rash of the syphilis involves the palms and soles. A child presents with fever and nuchal rigidity. Lumbar puncture was performed that shows predominant lymphocytes, decrease in the sugar levels and high protein. The chest X-ray of the patient reveals lung fibrosis with hilar lymphadenopathy. What is the most likely diagnosis? Of course, everybody by now must have diagnosed that this is meningitis. That's not the big deal because all the options are meningitis. Now you have to figure out that this is which type of meningitis. Number one, a very important hint that you see over here is there is decrease in sugar. Decrease in sugar means it has to be the bacterial meningitis. See, I told you the bacteria loves glucose. That's why they consume it. Let's think about it like that. So bacterial meningitis can do this. Now in this there are two guys as such which are bacteria. One option is bacterial meningitis itself and another is TB. What is TB? TB is a bacteria as well. So both of them can lower the sugar. Now how will I know if it's TB or meningitis, bacterial meningitis? There are two hints that are given. Number one hint is if you look at the predominant cell, if it was the regular bacterial meningitis, what we call as pyogenic meningitis, neutrophil should have been the predominant cell. But in TB meningitis, lymphocytes become important. That means the hint number one where I know this is TB meningitis is the lymphocytes. Second thing, they have also given about lung involvement. What else do we need? We all know, right? When TB is involved, we also get hilar lymphadenopathy, right? So you all should understand this properly, that hilar lymphadenopathy, the lymphocyte presence, etc. is straight away hinting towards the TB meningitis. So basically this person might have developed tuberculosis which has disseminated to the brain, causing this TB meningitis. You can just have a look over here. We had discussed this again in the important questions, something which is on exactly pretty much, the same lines about the sugar levels, the glucose, etc. This was the question we had discussed, and in detail I told you to remember this sugar things. Sugar is lowered by tubercular and the pyogenic meningitis. Next question, friends. A male working in a cattle farm presented with a skin lesion on the forearm. Okay, here itself I'm thinking something, right? Cattle farm, skin lesion. So this has to be the eschar they're going to talk about. Gram stain of the causative agent showed purple brick-shaped organism. See, gram stain pe who is going to appear purple? Purple is going to be gram positive. Brick shape means rod shaped and purple means gram positive bacilli. And we know this answer is Bacillus anthracis already, right? Maybe let's just read. If you all recall this thing, this guy has this boxcar appearance, or what we talk about as the bamboo stick appearance. I told you in this, if you look at the spores in the center, they are described as the non-bulging spores, right? Clostridium has the bulging spore, whereas this Bacillus anthracis has the non-bulging spores. So this is a very clear-cut indication of this. See, with the word cattle, even the answer could have been brucella, but why is it not the answer? Because they are giving you a typical presentation of the eschar over there. See the question, my friend, right? Do you see? I have told you the people coming in contact with skin of animals, right, to make leather, etc., they are more prone to getting this infection. Yes or no? So there was an exact question pretty much like this, and remember the answer to this, they are all the appearances. Simply my question was, all the appearances are seen with anthrax, which one is not seen? So carom coin colonies was the answer for this. Another question that we had discussed, again related to that black eschar, the farmer, leather factory, coming in contact with the cows, that is the cattle. So these are all the buzzwords that we have repeatedly emphasized on. Next question, friends. A chronic smoker presents with high fever, cough, confusion and diarrhea. Chest X-ray reveals bilateral lung infiltrates. A sputum sample was collected and the gram stain revealed gram-negative organism. Which is the most likely agent? Chalo. So if you just look at these things, options, I don't know if all the options were given exactly like this, all the agents causing pneumonia or not. But there is one thing that is the buzzword in this. So if we are suspecting the pneumonia, okay, there might be some buzzwords. For example, if they had mentioned alcoholic patient, then we should start thinking Klebsiella. Okay, Streptococcus pneumoniae, as such lobar pneumonia, the most common cause of that is Streptococcus pneumoniae. Why I would choose Legionella as the answer over here is because they had mentioned diarrhea. I had told you several times, if you see pneumonia with diarrhea, right, specific feature in this, then we should start thinking, Legionella. If you see very clearly, we said the mode of transmission of this is from the air conditioners. That is also a buzzword. If you see the Legionnaires disease, we said it's a pneumonia along with a diarrhea, right? So that's why the answer to that would be the Legionella. All right, another question, culture media that is helpful in differentiating the lactose fermenters versus the lactose non-fermenters. If this is how the question phrasing was done, that means it was quite a straightforward question. We all know for the Enterobacteriaceae family especially, we use McConkey's agar. And McConkey's agar, if you see here in the question discussion we had done earlier, McConkey's divides the organism into lactose fermenters and lactose non-fermenters, where I told you in fact more details like who is a lactose fermenter, who is not a lactose fermenter, and what else can we do to differentiate them. So since the question simply asks lactose fermenters versus non-fermenters, then straight away the answer goes down to McConkey's. A military officer who was injured by a blast injury presented to the emergency department. Examination shows crepitus at the site of injury. I think that's the foot that they had mentioned. Sample collected from the site on microscopy showed a rod-shaped organism with no spores. What is the most likely organism? See, one thing that might have confused most of us, they gave the option as no spores. See, we all know Clostridium. Clostridium genus, they produce spores, where we have even learnt the Clostridium tetani, it produces terminal spores, giving the drumstick appearance, etc. And the other Clostridiums may produce the subterminal spores. So we are all used to thinking that Clostridium produces spores, right? But I don't know for what reason they have given. Maybe rarely they don't produce spores also. Okay, but how could I actually pick the answer from this? See, first thing, if you look here, crepitus word was very catchy here. Crepitus is a classical thing that we see in the gas gangrene. So you should know gas gangrene obviously would be caused by Clostridium perfringens. Alright, so that's all about it. If they wanted to tell you this is tetanus, they would have given you some contraction. It's not a eschar or anything, so this cannot be anthrax, right? Burkholderia causes something else, called as myeloidosis, which is a pneumonia. So the best answer from the given would be Clostridium perfringens. Now, what is the agent that is used in plasma sterilization? Again, a direct question if this was asked this way. See, the option number 1, ethylene oxide, this thing is used in gaseous sterilization. So that is not the answer. They are asking plasma sterilization. In plasma sterilization, vaporized hydrogen peroxide is used. Aldehydes, etc. Although these all things mentioned here are high level of disinfectants, right? Chemical disinfectant here is aldehyde, formaldehyde, glutaraldehyde, etc. Yes, even if you had just read it once, maybe you would recall. Ethylene oxide couldn't have been the option because ETO or the ethylene oxide is the gaseous sterilization. So bacha, if the other options were not that simple, then the answer would be easily picked as H202 at least. Okay, coming to the last parts, this is what I would call as brownie point questions. Technically, yes, they will not be our micro questions, but they would be, let's say, applied questions from micro. Now see here, doctors. A young patient had a bout of dysentery, following which he subsequently developed bilateral ascending quadriplegia. Pain and proprioception is preserved. What is the most likely diagnosis? Okay, the buzzwords here, number 1, dysentery. Okay, bloody diarrhea. Next, if you see ascending paralysis, I have told you so many times, after a diarrhea, if they mention a clinical scenario where they're talking about ascending paralysis, they are describing one of the complications known as Guillain Barre syndrome. GBS जो हमने बोला था, Guillain Barre syndrome, ascending paralysis, where I in fact told you the word toes to nose. The weakness would be described from toes to nose, meaning this is basically from the lower limb to the upper part of the body. And you can see this is all discussed in the topic of Campylobacter. Campylobacter causes that bloody diarrhea, following which we can expect this Guillain Barre syndrome. The last question here, a 25-year-old patient developed an upper respiratory tract infection. 10 days later, the patient developed edema and hematuria. Investigation revealed anti-DNAase antibodies and decrease in the complement factor, that is C3 levels. Which could be the possible diagnosis? The answer to this, if you see a respiratory tract infection which is followed by a renal problem, so many times we had emphasized that this has to be PSGN, that is post-streptococcal glomerulonephritis. And even during our classes, we had discussed that since it's a nephritic syndrome, we would be noticing hematuria, and there was a specific thing that was described as what? It was described as the cola colored urine. So this was again discussed in my 25 important questions. As you can see here, I had given you a case scenario where we talked about that PSGN, and the causative agent to cause this PSGN is nothing but your group A streptococci, that is Streptococcus pyogenes, the same agents who can also cause rheumatic fever. Okay, so with this, our discussion of these questions that has come ends here, and I wish from the bottom of my heart that you guys pass this exam with flying colors. So that's it from me, friends. If you liked it, thank you very much. It was a good journey with all of you. All the best.